So let's draw the diagram together. So to begin with, we draw the anterior superior iliac spine and the pubic tubercle, and then joining these two we have the inguinal ligament which forms the base. Then we're going to draw the medial border of sartorius and the medial border of adductor longus. Okay, so this is basically the triangle. Next, the medial most structure in your femoral triangle is the femoral vein. Okay, so this is the femoral vein, and the great saphenous vein opens into the femoral vein through the saphenous opening. Next we have the femoral artery, and the femoral artery gives off the profunda femoris artery, the deep branch. Next we have the femoral nerve. Now remember, the femoral nerve comes down. If you remember, before it comes down, it supplies two muscles, the iliacus and the pectineus. So it comes down, divides into the anterior and posterior divisions. So we have the anterior and the posterior. Now posterior supplies the muscles and continues downwards as which cutaneous nerve? The saphenous nerve. Now if you remember, the profunda femoris has three branches, out of which two I'll mention now, the lateral circumflex and the medial circumflex. Now the lateral circumflex branch of the profunda femoris passes between the anterior and posterior divisions, and that's what's being drawn in this diagram. Okay, and if you remember, the medial circumflex artery passes between the two muscles, the two P muscles, the pectineus and the psoas major. Okay, so this is about the femoral nerve, and one more structure is there, and that is the lateral cutaneous nerve of thigh. Okay, now what is the important clinical relation, clinical and applied anatomy related to the lateral cutaneous nerve of thigh? Its compression leads to a clinical condition known as meralgia paresthetica. Okay, so this is basically your, and don't forget the lymph nodes. So this is basically this is your femoral triangle. Now, so we've discussed the femoral triangle.